Because the disease is what we call an autoimmune disease, what we have to do is suppress the body's immune system to stop it creating this pathway of inflammation and organ damage. And the organ damage is mostly skin and muscle. Suppressing the immune system really means steroids in the mainstay. So corticosteroids or cortisone or prednisone, there are various trade names of the different drugs, are used to dampen down the immune system. And so if you dampen down the immune process and the inflammation in the blood vessels, then you stop the ongoing damage to the muscles and skin, and then you start the healing process of that.
Most patients who are on steroids will get steroid-related side effects, and so in simple terms they relate to things like increased appetite and weight gain, sometimes problems with sleep and behaviour.
Her weight gain, so that was pretty much instantaneous, her weight gain, which also turned her into very restless nights.
When you're on the medication you get sick of taking it, and sometimes when I took the meds I could get emotional or angry and different to what I was.
We had to be conscious of his diet in the first 12 months with the steroids. They do make you hungry, very emotional, and so we were then off to see the dietitian who helped us with food choices.
So the result is children will have an often insatiable appetite, and they'll eat more than their body actually needs. The consequence of that is they can gain weight well above and beyond their recommendations for their age.
I ate a lot more food.
Definitely lots of vegetables, because that's going to provide a lot of bulk without a lot of energy, which I'd recommend to any child, whether they have JDM or not. Fruit is also very low in energy. The prednisone treatment can have detrimental effects on bone health. Children typically need between 2 to 4 serves of calcium every day. Calcium is mainly dairy foods, it is in other foods, but the easiest form I've found with children in the past is getting in enough of those dairy containing foods.
The most common drug that we use in association with the steroids is called methotrexate. We have to reassure families that even if they look on the net and they see that it's a cancer-related drug, that their child does not have cancer.
When we came off the prednisone, that's when the weight all fell off, and we were just having our methotrexate once a week and a blood test. I think we were doing them every 3 months after a while.
Parents need a lot of patience. I certainly don't downplay the first few years that they go through of maybe bringing their child repeatedly to hospital, seeing the side effect of the steroids, noting their docile kid may get a bit more cranky.
If you follow what they tell you to do, you'll get there in the end. Yeah, there is a light at the end of the tunnel.